BSI, Safe, PPE. Today I'm talking about med administration. The first one I'm talking about today is going to be nitroglycerin. You would give nitroglycerin to somebody who is complaining of chest pain. The contradiction for this would be a systolic blood pressure under 90, or if they've taken any ED medications within the last 24 hours. You give this sublingually, and it comes in spray or tablet format. So to give the spray, you would prime it by spraying it twice in the opposite direction, and then you're going to spray it underneath your patient's tongue sublingually. It is a vasodilator. The dose is 0.4 milligrams. The desired effect is reduction in chest pain, and an adverse effect would be decrease in blood pressure. So you can give this more than once, as long as you're checking their blood pressure first every 5 minutes and making sure that that systolic number is staying above 90, so that it's nitroglycerin. The next one on the list is going to be Narcan. This is given for opioid overdose. There are no contradictions for this. This is given intranasally. It is in a syringe here with fluid in there. The dose for this is going to be 0.4 to 2 milligrams. So I would start out by measuring out 0.2 milligrams in the syringe and give it in 1.2 milligrams in one nair, and then 0.2 milligrams in the other nair by squeezing the syringe to the 0.2 mark. The desired effect is to pull that person out of the opiate overdose, and there is no adverse effects with Narcan. You can give it again up to 0.2 milligrams. All right, the next one is going to be an epinephrine. This is an EpiPen. It is given for anaphylactic shock. There are two different pens, so you need to make sure that you're using the correct one. It's because there's two different dosages. So the dose is going to be 0.3 for an adult and 0.15 for a child. The contradiction doesn't have any contradictions. How you would give it is intramuscularly via injection. It is a bronchodilator and a vasoconstrictor. The dose, I already told you. The desired effect is to pull that person out of anaphylactic shock. And the adverse effects could be increased heart rate. The way that you give this is you're going to pull off the safety blue at the top. You're going to hold it on the side. You're going to inject it intramuscularly, so the thigh is a good area. And you're going to hold it there for about 10 seconds to make sure that all of the medication is supplied to the patient. So that is the EpiPen. And then the last one on our list here is going to be albuterol. The reason you would give albuterol is for shortness of breath. There are no contradictions for this one. How you give this is by inhalation, orally. So when you first undo the package here, this top part's going to be in 3 separate pieces. So you're going to put all those 3 pieces together, and then you have your little bucket here. You're going to take the albuterol solution, which the dose is 2.5 milligrams. You're going to pour all of that solution into your bucket here, and then you're going to screw the top on. Once you get that all set up, you are going to connect your hose to your oxygen tank, and you're going to set your oxygen at 15 liters per minute. You are then going to give it to your patient and have them inhale it until the whole treatment is done. The desired effect is a decrease in shortness of breath, so they're able to breathe better. It is a bronchodilator, and it may have the adverse effect of increased heart rate. This is another medication that you can give more than once if needed.